has undergone the kidney transplant, then they totally don't use the immunosuppressant drugs. What are the effects?
Okay. So when a patient has undergone transplant, it is prudent that they are actually on immunosuppression because if they do not have the antisuppression or the immunosuppression medications, there are risk of rejection of that kidney by their body fighting it. You know, you've given them a foreign body from another individual. So the body's defense forces or the immune system has to be sort of regulated to see this kidney as a peaceful organ. When that regulation is out, then this organ will now start to be attacked by the body's immune system. And so what this means, it will eventually result in failure of this kidney. There might be a period, maybe a couple of months, where it might be okay, but eventually there will be complete rejection, whether it will be acute, or acute meaning early on, or slightly delayed, but the kidney will eventually fail and become useless. Yeah.
So then, if this person is using the drugs, but then they stop along the way and resume sometime later after getting funds, will the body be resistant to the drugs?
The body does not develop resistance to the drugs. The function of the drugs, like I said, is to modulate how the body views this new organ. So if you are on immunosuppression, then you go maybe because of financial implications and stop in between. This period where you have stopped the immunosuppression, at that point your kidney is at risk. So there are some tests that would be done. You would need a biopsy where we take a small piece of the kidney using the ultrasound guidance, and the biopsy is looked at to see if there are any white blood cells forming in this kidney, which is usually a sign that you're beginning to reject. Now, if the kidney is not fully rejected and you go back to your immunosuppression therapy or your medications to modulate your host immune response to the kidney, there might be an ability to salvage that kidney. But it all depends on the duration which there was no immunosuppressive therapy. So the longer the duration, the higher the risk that the kidney will already be non-functioning or will already have been destroyed by the body's host system. So that's why we prefer that the use of the immunosuppressive therapy is continuous and uninterrupted.
So that means if the kidney has rejected already, it can't be salvaged?
So usually it depends the degree of rejection.